Kathy, we've been associated for a long period of time, and I understand that you do a lot of facial enhancements and fillers and things of that nature, such as botox and some of the other wrinkle fillers and things. Could you expound a little bit on what you do use and why you use what you use so the patients can have an understanding of that?
Would love to, Dr. Buck. Can I use you as an example?
Certainly.
Great.
Lord knows I'm an example.
Well, typically a patient would come in and they'd say, Kathy, what should I do? I'm looking for something to look younger, and I just feel kind of blah. I feel like I'm looking old. What should I do? Should I do Botox, wrinkle fillers? And people need to understand the difference between the two. Number one, Botox, Dr. Buck, as we know, is a substance that's put in a neutralized toxin that will actually paralyze the muscle for a certain period of time. Generally, where we would do it would be to do it on the upper face. So if I would look at you and I'd say, Dr. Buck, if you'd like to soften those lines between your brows, we would Botox those. And in effect, then when a patient wanted to frown, like I can't because I'm Botoxed, they would not be able to frown. They would not be able to make that expression that will create those lines. So the lines will relax out over time. The same with horizontal forehead lines. If you'd like to relax those, we would Botox in that area, and over time those would relax out. A third area principally we do is around the eyes, for what patients normally call the crow's feet. When they smile, they might get the laugh lines going out on their face. This will soften all those laugh lines so they still smile normally, but they won't have the lines associated with them. Those areas generally you don't put fillers in. You wouldn't add something to those areas. You just use Botox to soften those lines. One area we can put fillers, though, we talked about the lines in between the brows. Those Botox won't reach in and pull those apart. It will relax it so you can't make the expression, but if you already have a line in there that's deep, you're going to have to put a little filler in there too, just to fill up that line. So the combination works beautifully in that area. And Botox will generally last a patient about 3 months, and then they need to come in and have it done. It actually takes less than a minute to actually inject a patient. It's so quick. They're just in and out, no trauma, no downtime. They can go back to work and do whatever they want. So that would be Botox. Generally, on the lower half of the face, we're going to do fillers. Most of the time with an aging population, people start drooping and they start getting jowls in the face. Their lines from their nose to the corners of the mouth, which we call nasolabial folds, get deeper because the skin is folding over. They might get wrinkles from the corners of the mouth down to the jowls with the folding of the skin. Those are called marionette lines. Wrinkles around the lips lose volume. Interesting thing, they could have unevenness of their nose. They could have, a little lopsided of the nose. They can have, maybe they've had what we call a blepharoplasty, where they had surgery and they went in and had skin removed bags underneath their eyes, and now they're left with hollows. Or they have dark circles under their eyes, or they don't have cheekbones anymore. These are all things we can use different fillers on to go in and actually reconstruct their whole face. So it's really a neat thing to do, and generally if a person would come in, I'd look at their face and I'd determine, wow, what is actually causing the problem in the first place? I'm just not going to go in and fill up the wrinkle and say, okay, see you later. It's what is causing those folds. If it's because their skin has shifted from up here to down here, then we need to go in and build this back up so it pulls the skin up, which will actually lessen their nasolabial fold and fill in underneath their eyes and actually bring back the fat that they had when they were young. So the whole thing is geared toward, we want to actually make you look younger, not just a flatter face with filling and wrinkles. So, and different wrinkle fillers are meant for different things. You have wrinkle fillers that are hyaluronic acid that are Restylane and Perlane. Those are made by the same company. One Restylane has smaller molecules than the Perlane. So where you would use it is if you had fine lines, say around the lips, or very fine nasolabial folds, or very fine marionettes. You can use Restylane in there, and you can use it in the lips too to volumize. But remember, it has a very small particle size, which consequently means it's not going to last very long. Typically, Restylane lasts about 6 months. So you would use that in the areas I described with only a longevity of about 6 months. Perlane, on the other hand, the same company makes Perlane, but it has thicker molecules, bigger molecules. So you put it in the skin a little bit deeper, and it could be for a little deeper folds, a little deeper marionette lines, for more volume to the lips. Principally in those areas, you can fill in between the brows, but the longevity on that is anywhere between 6 months to a year. So those would be hyaluronic acids. Those are generally where I use those, and in between the brows too. If I'm going for more facial volumizing enhancement, building up the cheek areas, going in underneath the eyes, pulling the face up, I will use one of two products. I will either use Radiesse, which is a calcium hydroxyapatite product. It kind of looks white like toothpaste, and that's implanted underneath the skin, and it will last anywhere from a year to 2 years. Nothing downside with the product except you can't put it in the lips. It has the ability to form lumps in the lips, little like calcium deposits, and although you can break them up, they're kind of troublesome, and there's no need to go there with it. So generally I'll use a lot of Radiesse in folds, marionette lines, building up cheeks, underneath eyes. Those are all good places to use that product, and consequently it has a longer longevity for the patient. One of my favorite products, if we're talking about pure volumizing, is Sculptra, which is so different than any of these other products, because all the other products, they come in a syringe, Dr. Buck, and you just shoot them under the skin, and it's a goo that is underneath the skin and gradually breaks down. So then they have to come back in and have it done again. Sculptra, on the other hand, is minute little crystals of polyl-lactic acid mixed in a bacteriostatic water, just like normal saline. So you're basically putting water and these little crystals together, mixing it up, and then shooting it underneath the skin. It's like shooting water because it doesn't have any consistency to it. And so you would generally put it in an area like up in the cheeks, underneath the eyes, and the temples. If patients are very sunk in, like HIV positive patients or patients that have lost an extreme amount of weight, then you would put it in there, and this substance grows over time. It's so cool because unlike a paste that's just in there and it starts breaking down, this actually expands. The patient looks better as the months go along. And the neat thing is it lasts up to 3 years. And incidentally, it's the least expensive of all the products. In a vial, you get 6 to 7 cc's of product in a vial. And generally, you'll use a vial on one side and a vial on the other if you're doing the face, the upper face. And they'd come in about 6 to 8 weeks later and check and see if they might need another round of it, because it's a process of building up. But with all these procedures, Botox and fillers, the patients will come in, have them done, and generally there is not any such disfigurement or trauma. They can't go out and do anything they want that day or night. Actually, they look better leaving than when they walked in, because a lot of people are afraid, thinking, oh, I have to do this on a weekend when nobody's going to see me. It's like, oh my goodness, no. You're going to look better walking out than when you walked in.
Very good. Well, thank you.
You're welcome.